Diagnosis 1. Do I have breast cancer or not? Before. To determine whether you have breast cancer or not is not an easy diagnosis. Very often, it takes time. The majority of anomalies or problems in the breast are in fact mild. This chapter will inform you about which tests can be done and how they are done. How is the diagnosis made? The diagnosis is mostly determined in 4 steps. 1. Yourself, the doctor, the census sees or feels that something is not as it should be. 2. You go to the hospital for a test, often to the mammapoly. Is it fine or is it malign? 3. You undergo an operation. The suspicious tissue is removed and is analyzed. 4. 1 week after the operation, you are given the real or definite diagnosis. In this period of time, you see many doctors and nurses. A tip. Make sure that you always take somebody with you, for yourself and for language difficulties, because you need to understand everything correctly. If you get some bad news, maybe you won't be able to listen very well. Preferably do not take your child with you, rather your sister or a good friend. The hospital can always make sure that there is an interpreter, or can always call the interpreter service line 088 2555 222. Website www.tvcn.nl. You can ask for this service in advance, preferably in advance. Besides, there are always several consultations. For the tests, you can also ask for a female doctor. Unfortunately, it is not always possible to get a female doctor. Which tests could take place? There could be many tests to determine what the problem is. Not all the tests are always necessary. Sometimes you have to go to another hospital, because not all the hospitals have all the necessary equipment. A lot of research is being carried out on breast cancer, and new methods and new equipment are constantly being discovered to detect breast cancer better and faster.